Hi, and welcome to Veterinary Compassion Project's podcast. And today I'm very excited to introduce Dr. Rebecca Bailey, who is a leading trauma therapist who specializes in complex case scenarios. With over 30 years of experience in the field, she remains dedicated to the belief that authenticity, common sense, and kindness are the most essential components of effective treatment. A lifelong equestrian and animal lover, Dr. Bailey continues to find that animals, particularly horses, have much to teach humans about curiosity, compassion, and connection. She is the author of Safe Kids, Smart Parents and Equine Connections, Polyvagal Principles, a book of story, theory, practice, and hope, co-written with Margie, McDonald, and Jaycee Dugard. She is also the co-author of several peer-reviewed articles on abduction, high conflict families, and in collaboration with Dr. Stephen Porges and Jaycee Dugard, the concept of appeasement as a survival strategy. Dr. Bailey co-founded the Polyvagal Equine Institute to support the application of polyvagal principles in therapeutic and educational settings using the power of the horse-human interaction to foster connection and healing. Her work continues to bridge neuroscience, trauma recovery, and the healing power of the human-animal bond. Thank you so much, Dr. Bailey, for sharing your time with us. And I like to talk about in Veterinary Compassion Project that it's really hard for us to move forward if we don't stop and look backwards. And so I would love to hear about the Polyvagal Equine Institute.
Thank you so much. I'm so happy to be here. I continue to be very, very committed to supporting veterinarians as well. I've had a lifelong relationship with veterinarians at 9 years old, 9 to 14 clean cages outside of Boston for a veterinarian. So Polyvagal Equine Institute was born out of this relationship with Dr. Porges, which in 2012, we met him when we were looking at getting rid of the horrible term Stockholm Syndrome. What we learned was in many survivors, names you would know and names you wouldn't, the concept that they, quote unquote, fell in love with their perpetrator was quite offensive. So we set out to find a new word. Going back, believe it or not, in 1989, when I was in grad school, I was one of the very early animal-assisted folks. Back in the dinosaur age, I was part of bringing animals into a state hospital in the for the impact of seeing what we would see with blood pressure and verbal connection. And of course, we did very well. I had a moment of panic when the pot-bellied pig, I was working with peed on the individual who hadn't talked in 20 years. And thank God he said, pig, and shocked the nurses who hadn't heard him talk in like our 10 or 20 years. And so it was the beginning. And of course, I don't think we went back to Highland Hospital after that, but so I have was really been really dedicated to the human animal bond in teaching us to be more compassionate.
Wonderful. So what does polyvagal mean? Because you're talking to a group of veterinary staff members who probably have never heard that term, the polyvagal theory.
Yes, or they know it from a very much more sophisticated medical term than I know. I mean, I know up at UC Davis, they're working with the foals, and when I forget what it is, the holding process, it will bring them back. And what I've learned is that I'm being very, the people listening are probably like, oh, she's out of pay grade here. But we do know that part of that is activating the vagal nerve. So all mammals have vagal pathways, all of us. It's part of what allows us to be co-regulated by another. It's without that, you wouldn't be able to have a baby nurse, all of those type of things. And so Dr. Porges's research originally was on sudden infant death. That was his full focus. And he was looking at SIDS and looking at what he calls the vagal paradox, which is how the vagal break slows down the heart, can also kill. And he believes in sudden infant death. That was part of it. And then he started looking at autism. And in autism, what he was seeing is the impact of the vagal nerves. It's actually two nerves. It starts at the brain stem, innervates all the different organs. And what he was noticing was certain music and sounds, you could see a loosening of the occipital nerves up here. And then his research kind of went into the trauma field, where we began to understand that as the vagal nerve developed over many millions and millions of generations, it allowed us to regulate enough to take in information. And in the case of humans, and probably many other mammals, when you're in a regulated state, you are able to access the cerebral cortex. So the main piece of this is that we call it bottom-up processing. In a regulated state, you can then problem solve. If you're dysregulated in a survival state of fight, flight, or shutdown, you can't take in information. The most powerful way I bring this home is I have a video of horses galloping around, and I'll ask people, would you go in here right now and ask the horse to calm down? No. And even the most hardened, although there are some of those cowgirls that go, yeah, I would, and you're like, well, I wouldn't. And I've ridden horses since I could walk. So just understanding that piece. So that's important. So we believe in a regulated world, when people are more accessible to each other, people can take in information and access compassion and curiosity. It's a lofty goal.
No, I love how because I hear about the vagus nerve, and of course we need to be able to regulate our parasympathetic and our sympathetic nervous system, but I've never heard anybody describe it as we know why we should do it, but never heard anybody say we should do it because we can access a different part of our brain. And I love that you said that.
And I'm very blessed to have developed a good friendship with another woman named Deb Dana, who wrote a great book called Anchor, and many others. She's a dear friend who also teaches the theory. And what I love about her and Porges is when I check in on my simplicity and say, because people, if you go on the internet, there's a lot on polyvagal, and I'm going to just say, unless it's Dr. Porges or Deb, and
Yeah.
include myself in this, don't get caught up in the over intellectualization of the process. We are not neuro anatomy scientists. What we're saying is what we have seen in real time. And over the years with the Jace Foundation, Jaycee Dugard's foundation, we have trained law enforcement, judges, all these other individuals to understand that importance of a regulated state. So, for example, with judges, if they can understand in the courtroom, which is a very difficult challenge, if they can get people to feel safe enough to feel connected and not activated in an awful state, they get better compliance. And so I'm going to say to veterinarians as well, in addition, I know your program is really all about the self-care, and it should be. But you also have to understand, if you lose compassion, curiosity, and connection, you lose your ability to communicate effectively. Really hard.
Absolutely. So for those of you guys who don't know, I know if veterinarians are listening to this, they understand that the vagus nerve controls the parasympathetic, and our parasympathetic nervous system is our rest and digest. And we know our sympathetic nervous system is our fight, flight, or freeze. And speaking especially from experience, on the floor with veterinary emergencies, there's an enormous amount, and not even veterinary emergencies, just, maybe there's an upset client or something didn't go right. And we tend to be in this constant elevated state of our sympathetic overdrive and not having enough of the parasympathetic to balance us, where we don't want to be one or the other. We want to be both and balanced and regulated, just like you said. And so using different techniques to stimulate the vagus nerve, which again is in control of the parasympathetic nervous system, helps to down regulate the sympathetic and up regulate the parasympathetic. Did I say that?
It does. I think it's also important to clarify that we know that there's all sorts of neurotransmitters and other things going on, but the simplicity model says that the vagal pathways innervate key organs in the sympathetic, parasympathetic, and sympathetic nervous system. And then what Porges brought forth is this newer part of the vagal pathways, which allows for social connection. Because of the vagal brake, we can have our heart rate slow down enough so we can be in proximity with each other without wanting to flee, without being activated to the point that we can't process. The other piece that is important to also know, and this is sort of a newer thinking, and is that the freeze response can also be the active deer in a headlight freeze, where there's a freeze and then movement, or there can be the deep freeze of what we call, and there used to be a thing called voodoo death, where people would get so frightened in grief. When one person passes away very close to another after millions of years of marriage, what we also think that may be a part of that vagal brake going on so deeply in the grief response. And I'm going to just quick story of, I had a beautiful mare who passed away. Well, we had to put her down at 36. It was very difficult, but it was her time. She was quite a fighter. And like a week after, and hopefully we don't get, she's buried somewhere I will not disclose, but put it this way, the other horses, the two minis and her other best buddy of 26 years could access her. And there was very quick, like 4 or 5 days after, the little guy Aurora got on that, laid on her grave, and very low heart rate, everything else. The vet came out. It was like, we're all like, because they all knew this was my therapy horse. And Tess, nothing was wrong. There is no way that horse was not just grieving. Whatever we want to say about emotion, her physical body was in a place of feeling, whether the smell, whatever it was. She's doing great now. But I guess the reason I say that is that unconscious bottom-up processing of the physiological, say, whether from a pure clinical place, we might just say she didn't feel safe without this lead mare. That could have been it, right? That may have been all that was. But we do know that there was head scratching as to what is going on with this little horse. So I don't know, that was a bit of a tangent, but I thought
it's important, because I think that we as scientists tend to focus on the physical, and we've got to be wiser to understanding that there's multiple layers. There's an emotional, there's the mental plane, and that illnesses are penetrating and moving throughout all, and we just see the physical manifestation of disease. And so you can't deny that some type of trauma stays with you and creates physical problems. It's
and the bottom up processing, the physiological sells the story or sends a story, and then the brain applies something to it, whether it's logic or illogic. Other quick one I'll say, and I do think this is really important for veterinarians to hear this. I just had terrible asthma. I shared with that, and I was in the emergency room. I'm all okay now, but they couldn't figure out how to calm it down. This nurse came in, male nurse, and he was, giving me the breathing piece. And I was like, I was like, oh, I want this to be over. Yeah. He left the room. That man came back in, put his hand on my shoulder and said, I wish there was more I could do for you. I really do. Hang in there. And he left. Everything in my body shifted. So I'm saying that to veterinarians when you're busy and you've got 500 emergencies, and we all know about putting a hand on a shoulder. In my book as a psychologist, I have to ask, do you mind if I put my hand on your shoulder? But that tiny moment allowed my nervous system to relax enough to then hear what I heard was, hang in there, So I'm sharing that I think you guys have such a challenging job. And, I work personally with some veterinarians. I understand what's happening in the field. But when you lose your compassion for others and yourself, you lose the ability to really be effective in communication.
Yep, absolutely. So for you, why you started out with different animals, but why horses? Why did you really hone into the equine therapy?
The truth is I love horses, but to be very honest, I think what's really important with horses, and I also have an office where the dogs and cats come and go, and it's kind of silly, and some people get irritated, and that's just hard. In my office policy, it says my animals come and go. If that frustrates you, I may not be the right person for you.
Yes.
But horses in their proximity, they can activate in a person a response. It may be fear, whatever this piece is, it's sort of real-time ability to allow a person to experience an emotion that in an office they can only really talk about. So I do not believe horses are mirrors. When I first started in the field, my business was called Equine Mirrors, and I lasted that a year. And I thought, well, this isn't a mirror. The horse is communicating with the nervous system if we let the communication happen. So I think because of their status as mostly prey animals, although we've all seen horses be predators when the dog comes in, chase them out, those type of things, but they are prey animals primarily. They have to rely on their herd instinct and their ability to detect safety and then to let it go. And so for me, the most important piece with my trauma survivors or law enforcement or other populations we've worked with is the ability to teach the art of letting it go. To be flexible in the nervous system. That's Polyvagal Equine Institute. Think flexibly, the ability to let it go. We can't stop our physiological reaction. You can't stop being overwhelmed or irritated by that client who's, always coming in and never listening to what you said when they leave. But what we can do is own it in our body, pay attention to it, and maybe problem solve another way to communicate the same thing. And I think that's what horses do all the time.
Yeah, I agree. And I'm going to push you just a little bit further, because we talk about the horses and the heart field. And so what specifically do you think about horses that creates this response? And people who may have been around horses their whole life or may have never been around horses, do you have like something that you feel is very specific to the horse species?
I think, and I'm going to be truly disclosing. I know a lot of people love heart math, and I think heart math is useful to teach people about themselves. I haven't seen the algorithm, nor would I understand it if I did see it, to understand really what we're scientifically seeing there. And so even though I think it's very useful and a lot of people use heart math in their programs, I don't know what they're showing. So your question is very good. I think the horse's instinct, the horse's absolute ability to pay attention to the slightest shifts around them is so important to really teaching people to be truly mindful in the moment. Now, mindful from polyvagal doesn't mean sitting on a rock and meditating, even though I think that's a lovely thing to do. Mindful means you're mindful of your nervous system's impact on another's. So I think horses, particularly if they're at liberty, we do some haltering things because sometimes people are very afraid of horses, but the horse's ability to really tone in on their instinct is something that, for example, a man named Gavin de Becker wrote about in The Gift of Fear many years ago, was really about how as humans, we've lost our ability to listen to our nervous system. You watch a horse spook at the same rock, right? But you also watch them go and then recalibrate. And I think for me, that's the most important lesson they have. I also am different than a lot of the equine programs, where I think that the nervous system of everybody in the proximity is impacting the dance of connection. So it's not just this one two-way horse human, it's every human there, or it's, it can be the potbelly pig down there. There's all these beautiful nervous systems in this incredible symphony. Horses have an ability to hone in on the one piece. It is, are you safe or are you not safe? Does that make sense?
It does make sense. And there's just like, I might be in a bad mood and I walk out to my horse pasture and I literally put a hand on my horse and it instantly I'm changed. And within 10 minutes, I'm in an elevated mood. And I feel like, what does it matter that I was in a bad mood a little while ago? And it's consistent. It happens every time. And it's just so remarkable. I can't, because I'm new to horses. I've only had my beloved horse for about 4 years now. And his just calm being has been so transformative for me.
I'll tell you what Sue Carter, who is Dr. Porges's other half, who's an amazing researcher, she actually originally studied oxytocin in prairie voles. She's a brilliant, brilliant lady. People think of Meg Olmert, but I think Sue was prior. And what she talks a lot about is the two, and your veterinarians will know more about this than I really do, so I'm going to go into rocky territory, but the connection between vasopressin and oxytocin. And so that connection of oxytocin, you are able to access it and feel safe and not have vasopressin. Trauma folks, people under extreme stress, that feeling of oxytocin can also activate more vasopressin in their body. And vasopressin actually works on the vagal pathways in ways that I'm not going to pretend to be smart enough to know. But what Dr. Porges' wife, Sue Carter, is always talking to me about, and there you can find a great webinar on her on YouTube, really good one that she did at UC Davis. What she talks about, she believes in conversations we've had over the years, that moment you're talking about is the accessibility of oxytocin in your body. Horses can be super co-regulated. For some reason, that piece. I grew up in a crazy, crazy, chaotic family. The one thing that brought me down, and it was very difficult because I was very high strung, still am, was my horse. So I could come home from school, and I was lucky enough to hug Locket, and suddenly my whole system changed. I think that was me feeling oxytocin without feeling threatened. And she's always saying you should do tests and take blood. Horses have a lot of blood to give, and take the test from the horse and the human. And I'm not a big, I would love to. I wish we had a big study on that, because I do think it's not cortisol, it's oxytocin vasopressin connection.
That's fascinating.
She's cool.
Yeah, really amazing. So I think you would definitely agree, and it's undeniable for our listeners, that in order for us to move forward and have a balanced, harmonious life, that we have to look backwards and we have to handle our traumas. And there's many different ways that we can handle our traumas, and what feels good to one person may not feel good, may feel scary to another person. I love the idea for veterinarians and veterinary staff members bringing a horse into the picture, because it just seems so fitting for our traumas and to help us heal. So walk me through what that might look like. If somebody was reaching out to you for help, what does that look like for our listeners?
So you either have the individual work that I'm doing far less. I do still do some, very challenging, what we call complex cases, maybe a stranger abduction. There's unfortunately very few recoveries. I'll still step in when asked to do a period of that. But for groups coming, so for example, one of the things we really want to do is get people out of their head. And so it's really challenging when you have people in careers where they need their brain power all the time. They get very detached from being in their body, and almost a challenging. So you don't say, how does it feel? You say, where do you feel that in your body, or where? And that is a little better than the E word, emotion words. So let's say it's an individual that reached out to Polyvagal and said, I'm a burnt out, I'm going to say veterinarian, burnt out. I hate my job. I hate everybody, which many of us in people-oriented fields go through that, right? We're burnt out, compassion fatigue, vicarious trauma. We've watched this person. God, one of the worst stories I ever heard in this community was Y2K, when someone took all their animals in to be put to sleep, and she had no choice. I mean, that one haunts me to this day. Maybe they were older. I don't know. But so we all know that us animal people, have sometimes a very short fuse for human stuff. So the first thing we do is try to bring them into an environment where the nervous system can shift enough to feel safe with the oxytocin. And it could be just sitting around the horse, watching the horse, whatever it is. Things as simple as grooming, things as simple as going into an arena and having one or two different horses and noticing the impact. What we find is in the proximity of horses, people will pour out stories. Personally, I like to do that out of the arena because I feel like you're not present if you get back up into here. So one of my favorite new words that Porges has been talking about, I love his little nuggets because he's so sweet. He's just these nugget words. His new word last week was accessibility. If we can make ourselves more accessible to others and others more accessible to us, then we will have a more regulated world. And so to me, that's part of what we do. We always have a healthy lunch. Our friend Margie McDonald, who works with us, insists that we have vegetarian food, not for any political statement, but just to feel the nourishment of in that moment. It's very fun when we get our cowboys from the Midwest who get mad at us, like, where's the beef? We're like, go buy it and eat it in your car. So anyways, so the whole point is to take an environment and sort of throw a warm blanket around people and have them interact with the horses and experience that connection, even if they have fear of horses. And that often happens.
I was just going to say, I'd really like to stop for a minute and talk about the accessibility word, because that is one of my biggest concerns and challenges with the group of veterinarians and staff members. In order to become a veterinarian, it is extremely tasking, and we tend to be very independent, and we get through it on our own, and we are tough, and we just get through it, and we get to vet school, and we're in this competitive place that we're put in, and we go through that schooling sort of as on our own again, and then we all split up and we go to our own jobs, and once again we're on our own. So we have this history of isolating and building these walls around ourselves and telling ourselves consistently we're okay, we're fine, everything's fine. And so we have literally no access to ourselves or our emotions. It's a systematic process that I see through school and the jobs, and the inability to say, hey, maybe I'm not, or hey, maybe I'm actually not accessing how I really feel. And so I love that you said that, because part of healing is to first say, I need help healing. I guess step one.
Yeah, and realize it's not an intellectual process. I mean, it is interesting how it's a funny thing to say, but we just had two groups of judges, and how similar in a way it is. Judges get paid horrible money. Everybody hates them. There's always one person that is mad at you, one person that may appreciate you, or two people that are very disappointed, all of those things. But and how many of the careers you try to go up here and rationalize. The first step is getting to, this is really hard. I need support. We know that the antidote to connect, to, obviously it's so stupid to say this, if connection is social connection, right? Yeah. So what you're doing is brilliant, because that first step, think of herds of animals. They need the connection with each other in order to have an environment of safety. And you also need groups where you can say, I know this as a psychologist, and it's really hard because a lot of psychologists, like I worked a lot with high conflict divorce. I had a group where I could say, oh my God, I hate this woman, or, and nobody would go, oh, you can't hate that person. They'd say, okay, well, how can you deal with that inside yourself to be more accessible to that person? That word accessible. So I think it's so important to be able to notice it. I don't think a horse holds on to the reaction of like, and we know all the brain stuff, but get out of the brain right now, just stay in the body. A horse's nervous system doesn't get stuck on, oh, that's that guy yesterday who, yelled at his kid in front of me. They may have a startle, but they go back to a resting state. And we have to learn how to get our bodies back to a resting state.
Absolutely. And balanced. Mm-hmm. And I love the get out of the head, because we are a profession that stays in our head. Get into your body, feel what's going on, do body assessment, go through feet, legs, anything, just to feel exactly what's going on, and wait what may not feel good.
I encourage people in all of our professions to really work on pushing the balls of their feet down into the ground, lifting toes up, pushing everything down to get grounded. Take a minute, do that 5, 4, 3, 2, 1 thing where you look around and you say, oh, what are 5 things I see, 4 things I hear? I always get it wrong, but you know that all the different senses of 5, 4, 3, 2, 1, and then go forward, particularly if you have a really busy day. The other piece is I've noticed, first of all, it's very difficult with the proliferation of corporations owning all of our companies, including psychologists. Right now, psychologists are kind of where veterinarians were 5 days. All these companies are coming in and saying, oh, let me make your life easy, because they don't teach business school. In business, they don't teach in grad school business skills to therapists. So people are going into these corporations and they're starting to say, I'm miserable.
Yes.
Right? Because I don't understand how this all works. What we need to do within our pods is not let go of that heart that took us into the business in the first place.
Yeah, absolutely. Keep a handle on that.
Keep a handle on that.
And we, throughout all the interviews, we keep circling around this same concept of getting into your body, of spending time with yourself, of finding out who you are, how you feel, and then let's just boil it down to that word again. We'll come back to just making yourself accessible.
And I also think getting out of the hero complex, reminding yourself, because I think, again, particularly, I don't have the life and death situations you guys have, but I have people that come in with severe, severe trauma. And I have to remind myself, because it doesn't always go great. They don't always, I used to think they were always going to get better. The horses and the food and the connection, gee, isn't this great? No, not everybody can. And our job is to get out of that hero place. And the only way we do that is when we have people in our life that remind us. So it's about our reminding ourselves, but you've got to cultivate the social connection. So Erin, I'm so excited about what you guys do. And I want to support you in any way I can, because you guys are so important. You're important to these little beings, and these big beings. It's so important.
Yeah, it's a beautiful profession when it's beautiful, and it's a very difficult profession when it's difficult. And a few years in, I wrote a blog just recently about a few years after I started. A bunch of veterinarians, we took a limo ride, and it was the conversation on the way to hearing a lecture that was very healing. And so from that moment germinated this idea that we have got to be together as a community and talk about things beyond medicine, to heal.
And also understanding the little things. Here's another strange story. And since you guys are veterinarians, I really do want to share this. I had a little dog who was my therapy dog. She was with me with some extreme, extreme trauma cases. So when I had to put her down, she had seizures and she was older. Anyway, so long and short of it is I took her to the vet in the middle of the night, put her to sleep. I knew I was going to take her home and bury her. Again, won't tell you where, but so when I brought her back, she was all wrapped up, and I unwrapped it, and they had given her a bath and put a ribbon in her hair because they knew it was the most beautiful thing. I sent a terribly handwritten note my handwriting's awful, to the vet, just saying, because she was a new vet at this, emergency place, saying, I need you to know what you gave me. And so when I go and I see where little Stella is, I see this beautiful, and she was like 17. So, she was, but they put a little ribbon in her hair. And I don't know that anybody knows how important those little pieces are.
Well, and it plays into the thing that I say, that is, veterinarians and veterinary staff members are the most compassionate people I've ever met. They are the most loving and compassionate. And we just need to figure out how to bring it back home, how to bring it to ourselves so that we can keep being so loving and compassionate, and we can stay in the field.
And
So
I will support you guys, Erin. Anything I
thank
can do,
you.
I'd love to have a group come out. I'm sorry about the dog, but we're all animal people.
Ah,
Um, I would love to help in any way. If we can get a group to come
yeah,
out, I know Margie and I would love to offer a morning. You know, our Polyvagal Equine Institute, we are international. People know us. We're certainly not buying Mercedes on what we're doing, but we are making, I like to believe we're making the world a little bit of a better place.
absolutely. Yeah. And it certainly takes more than a village. And we've got your information on our resources webpage. And I want to thank you so much, Dr. Bailey, for spending this time with us and talking about your healing process. And thank you so much for all the great work that you do. So thank
Thank
you
you
so much.
too. All right. Take care.
You too.